Hi friends, once again welcome back to the Nurse channel. So hope you all are doing well and you are preparing very well for the upcoming AIIMS NORCET examination. So here we are with you people for guide you to prepare well or prepare better for the upcoming AIIMS NORCET examination. And keeping that in mind, we have started a series that is the AIIMS NORCET series, and this is the 8th video which is coming under this heading. And this session also contains 15 very important questions which are taken from the different aspects of our nursing subjects, and this includes repeatedly asked questions and picture based questions, and each question carries very detailed explanation that will help you to prepare very well for the upcoming examination. So and we are assuring you that these 35-minute videos or 30 minutes videos will definitely help you to prepare better for the upcoming examination. And I request everyone who are watching this video to watch the video till the end and kindly share about this platform to your nursing friends, and kindly subscribe our channel and support us if you are not yet subscribed, and kindly enable the bell button so that you will get notification whenever we are uploading new videos. So straight away we will move on to the 8th series of our AIIMS NORCET preparation. So 8th series. You are watching the NORCET series number 8, and the first question in the series is in the screen right now. The question is from the OBG diagnostics. So the question is, hysterosalpingogram uses which type of radiation waves? Hysterosalpingogram uses which type of radiation waves? Options are option number A, gamma rays, option number B, sonography, option number C, X-rays, and option number D, infrared waves. So what is the answer? So the answer for this question is option number C, that is X-rays. So you know that hysterosalpingogram. So hysterosalpingography, it is an X-ray examination of the uterus and the fallopian tubes using a special form of low dose X-ray to evaluate subfertility, infertility, or repeated miscarriages. Okay, so that is hysterosalpingogram. So here we are using low dose X-ray. Okay, so that's all regarding the first question. We will move on to the second question in the series. So the second question is, spinal anesthesia used on a patient needs monitoring for dash. So the patient underwent spinal anesthesia, so what you will be monitoring for that patient? So the options are option number A, oxygen levels, option number B, hypertension, option number C, renal function, and option number D, brain activity. So what you will be monitoring for a patient post spinal anesthesia? So the answer for this question is option number C, that is a renal function. So why, that we will be explaining in the explanation session. So we know that all the toxins and the administered medicines are removed by the kidney. So thus when anesthesia is given in the spine, it is usually a local anesthesia and numbs the lower part of the body. Okay, so since the lower part of the body had been anesthetized, kidney, which is also supplied to by these nerves, may also be affected. Thus monitoring renal function becomes very important. Okay, so urea, creatinine, like renal functions need to be monitored, plus output of the patient also need to be monitored. Okay, all aspects related to the renal function need to be monitored after spinal anesthesia. Reason already I have explained. So I think that also was very informative for you. Now we can move on to the next question in the series, question number 3. So what is the optimum temperature to store blood right after collecting it? So question is, what is the optimum temperature to store blood right after collecting it? So the options for you are option number A, 25 degrees Celsius, option number B, 22 degrees Celsius, option number C, 20 degrees Celsius, and option number D, 15 degrees Celsius. So at what temperature you will store the blood immediately after collecting? That is the question. So the answer is option number B, that is 22 degrees Celsius. Why? So that we will be seeing in the explanation session. So once the blood is collected, it is stored at 22 degrees Celsius. So at this temperature, the blood proteins are safe from degeneration and the cell function properly, and the presence of anticoagulants ensures that the blood is not getting clotted. Okay, so these are the advantages that we are getting if we are storing the blood at 22 degrees Celsius. Mainly this cell degeneration won't happen. Okay, so that is a reason at 22 degrees Celsius why we need to keep the blood after collecting it. So that's all regarding that question. Now we will move on to the next question in the series. So the question is in the screen right now, and the question is, Thanatology is the study of dash. Thanatology. So the options are option number A, injuries and assaults. Option number B, death of all aspects. Option number C, death related to thermal injury. And option number D, life after death. So thanatology means what? It's a study of dash. Slightly confusing. So the answer for this question is option number B, that is death of all aspects. So we know that thanatology is a scientific study of death and losses brought about as a result. Okay, so what about the afterlife? One option was regarding the afterlife. So the afterlife or life after death, it is the purported existence in which the essential part of an individual's stream, consciousness or identity continues to exist after the death of their physical body. So this is known as the afterlife or life after death. Just an information for you. So that's all regarding that question. So thanatology is the study of death of all aspects. Okay, so we will move on to the next question in the series, that is the fifth question. So during weaning, honey can be introduced only after how many months and why? So that is a question for you. Honey can be introduced at what age? That is a question for you, and the options are option number A, 8 months, option number B, 12 months, option number C, 9 months, and option number D, 6 months. So what is the answer? So the answer for this question is option number B, that is 12 months. Honey need to be introduced only after 12 months. Why? Honey should be avoided before 12 months due to the risk of infant botulism. Okay, so this is very, very important, infant botulism. So what is infant botulism? Infant botulism is an intestinal toxemia. Okay, intestinal toxemia. The disease results after the spores of the bacterium, that is Clostridium botulinum or a related species, are swallowed, temporarily colonize an infant's large intestine and produce the botulinum neurotoxin. Okay, so infant botulism is affecting the large intestine, and the organism that is responsible for this is the Clostridium botulinum or their related species, and this is present in honey. So sometimes from the honey the spores can get colonized and it can produce the botulinum neurotoxin. Okay, so some infants get botulism when the spores get into their digestive tracts. They grow there and produce the toxin. So honey can contain the bacteria that causes the infant botulism. So do not feed honey to children younger than 12 months of age. Okay, so that is a detailed explanation regarding the infant botulism and honey. Okay, so that's all regarding that question. Now we will move on to the next question, that is the sixth question in our series. So the question is, which among the following is a marker of neural tube defects? Okay, so we know that there are several tumor markers or the disease markers are there, so that is very, very important. So here I am asking about the neural tube defect marker. So the options are option number A, PAPA, PAPPA, option number B, HCG, option number C, histriol, and option number D, acetylcholinesterase. So what is the answer? Which is the marker of neural tube NTDs, neural tube defects? So the answer for this question is option number D, that is acetylcholinesterase. Okay, so all the options what I have given are some or the other markers, so that I will explain in the detail in the explanation session. So first of all, the prenatal diagnosis of neural tube defects is done by detailed ultrasound examinations, then measurement of the maternal serum alpha fetoprotein, that you know very well, then amniotic fluid alpha fetoprotein and amniotic fluid acetylcholinesterase. So neural tube defects can be identified by several methods, and in that the main things are maternal alpha fetoprotein, then amniotic alpha fetoprotein, then amniotic fluid acetylcholinesterase. Okay, so I think that is clear for you. Then now we will see the other options. So the other option was the PAP-A or the PAP-A. So this is PAP-A stands for pregnancy associated plasma protein A. Pregnancy associated plasma protein A. So it is a protein which is produced by the placenta. So it is needed for the implantation process and to maintain a healthy placenta. That means even after the birth. So PAP-A is a marker measured as part of combined pregnancy screening and blood test, which is offered around 11th to 14th week of pregnancy. Okay, so that's all regarding the PAP-A. Okay, so this is a pregnancy associated plasma protein. Okay, so the fetal well-being, everything can be identified with the help of this test, which is done during 11 to 14 weeks of pregnancy. Then comes the HCG, otherwise known as a human chorionic gonadotropin. So regarding this marker, already we have explained in our older videos. So it is a hormone which is made up of an alpha and beta subunits, and that is produced by the placenta, and normally is only measurable during the pregnancy. So some abnormal tissues like tumors or the blood cancers may also produce the HCG, making the HCG test useful as a tumor marker. Okay, so normally it will be produced during the pregnancy time only, but in some other cases, some abnormal cells or abnormal growths, they can also secrete the HCG, and that can be detected, and thereby it can be useful. It is useful as a tumor marker. Okay, so that is HCG. Then another option was the histriol. So what is histriol? Histriol can be measured in the maternal blood or urine, and it can be used as a marker of fetal health and well-being. And if levels of unconjugated histriol are abnormally low in a pregnant woman, this may indicate chromosomal or congenital anomalies like Down syndrome or Edwards syndrome, etc. Okay, so histriol levels, if it is very low, then it can give a light into the diagnosis of chromosomal or congenital anomalies. So that is the role of histriol. Then I think regarding these tumor markers, I think you are aware now. Now we will move on to the 7th question in the series. So question is, age-related loss of muscle mass, strength and function is called as dash. So age-related loss of muscle mass, strength and function. So the options are option number A, neutropenia, option number B, sarcopenia, option number C, osteopenia, and option number D, thrombocytopenia. Very easy question, but options are slightly confusing. So what is the answer? Muscle mass, strength, function. So the answer for this question is option number B, that is sarcopenia. So we will explain about these penias. So first of all, the answer for our question, that is a sarcopenia. So it has been defined as an age-related involuntary loss of skeletal muscle mass and strength, and thereby the function. Okay, so that is sarcopenia. Then next option was regarding the neutropenia. So as the name indicates, it is defined as a lower than normal number of neutrophils. You know that neutrophils is a type of WBC. and the normal level is 1500 to 7000 neutrophils per cubic millimeter of blood. Okay, so this is a normal neutrophil. Okay, so neutropenia is the lower than normal, that is known as the neutropenia. Okay, so another option was the osteopenia. So there may be confusion between osteopenia and sarcopenia. So osteopenia, it is a loss of bone mineral density or BMD that weakens the bone. Okay, so osteopenia is the loss of bone mineral density, so that is very important. So there is a scoring known as a T-score, and a T-score of -1 to +1 is considered normal bone density. So the normal bone density is considered with the help of a score known as the T-score, and a value of -1 to +1 is considered as normal. So a T-score of -1 to -2.5 indicates osteopenia, that is low bone density. So a T-score of 5 or lower is bone density low enough to be categorized as osteoporosis. So when we can call it as an osteoporosis is when it is when it is less than -2.5 or lower, then it can be categorized as the osteoporosis. Okay, so I think you are getting information regarding osteopenia, its scores, and when we can call it as an osteopenia and osteoporosis. So this score also you can remember. Okay, so then next one is the thrombocytopenia, otherwise known as the low platelet level, thrombocytopenia. So these levels, a mild thrombocytopenia means the platelet levels between 1,00,000 and 1,40,000 per microliter of the blood, and moderate thrombocytopenia means the platelet levels between 51,000 to 1 lakh. Then severe thrombocytopenia means the platelet levels between 51,000 and 21,000, so 21,000 to 51,000 microliters of blood. Okay, so thrombocytopenia I am not explaining much, so it is just low platelet level, and I have given the levels, so mild, moderate, severe. Okay, so I think that also was very useful for you. Now I think we can move on to the next question in the series, that is the 8th question in the screen right now. So the question is, the synthetic form of vitamin K is called as dash. So vitamin K has 3 forms. In that, what I asked in this question is a synthetic form of vitamin K. So the options are: option number A, menaquinone; option number B, menadione; option number C, hydroquinone; and option number D, phylloquinone. So which is the synthetic form of vitamin K? Slightly confusing, so that confusion we will clear during the explanation session. So the answer for this question is menadione. Menadione is the synthetic form of vitamin K. So first of all, that vitamin K2 or menaquinone is one of the 3 types of vitamin K, and the other 2 being vitamin K1 or the phylloquinone and vitamin K3 or the menadione. Okay, so vitamin K1 is the phylloquinone, vitamin K3 is the menadione, and vitamin K2 is the menaquinone. Okay, so K2 is both a tissue and bacterial product which is derived from vitamin K1 in both cases, and is usually found in animal products or fermented foods. Okay, so vitamin K1, K2, K3. Okay, so the names also I have explained. So what is hydroquinone? Hydroquinone is used to lighten the dark patches of the skin. Okay, so that is not related to vitamin. So it is also called as the hyperpigmentation. Hydroquinone is used for hyperpigmentation, melasma, liver spots, those skin conditions. We are administering sometimes over the local application, like we can give topical application, that is the hydroquinone. So this is these patches which can be caused by the pregnancy or the birth control pills or hormone medicines or injury to the skin. Those conditions, that hyperpigmentation can be reduced with the help of a drug known as the hydroquinone. Okay, so that is hydroquinone. Then other options already I have explained. All are one or the other forms of vitamin K. Okay, so that's all regarding that question. I think we can move on to the 9th question in our series. So the question is, the ability to choose and concentrate on relevant stimuli is called dash. So a question from psychology. the ability to choose and concentrate on a relevant stimuli is called dash. So the options are concentration, option number B attention, option number C observation, and option number D perception. Slightly confusing. So what is answer for this question? So the answer is option number B, that is attention. So we will see what is concentration, attention, observation, and perception. First of all, attention. So attention is the cognitive process that makes it possible to position ourselves toward a relevant stimuli and consequently respond to it. So we will be position ourselves towards that particular relevant stimuli and we will respond to it. So that is known as the attention. So then what is the difference between attention and concentration? So concentration has been defined as the ability to direct one's thinking in whatever direction one would intend. Okay, so if you want to direct your thinking or your thinking to one particular road where to be intended, so that ability is known as the concentration. Okay, so that is concentration. Then comes the observation. So observation is the careful close examination of an object, a process, or other phenomenon for the purpose of collecting some data about it or drawing some conclusions. Okay, so that is observation. So it is a careful close examination of anything, of an object, or maybe for a process or other phenomena for collecting some information about it and drawing some conclusions. Okay, so that is observation. Okay, so observation, attention, concentration, and finally the perception. So perception is the organization, identification and interpretation of the sensory information in order to represent and understand the presented information or environment. Okay, so perception already we know. So it's an organization, identification and interpretation. Okay, so that is perception. So don't be confused between these four terms. Okay, so I think that confusion has cleared. Now we can move on to the 10th question in our series. So the question is, which type of memory is also known as active memory? Okay, so which memory is known as the active memory? So the options are long-term memory, option number B short-term memory, next option sensory memory, and final option losing memory. So which is the active memory? So the answer for this question is option number B, that is short-term memory. Okay, so what is a short-term memory? Short-term memory, also known as the active memory, it is the information we are currently aware of or thinking about. So what we are currently aware of or thinking about, those memories are known as a short-term memory. And long-term memory, on the other hand, it refers to the unlimited storage information to be maintained for long periods or even for life. That is a long-term memory. So I'll be giving you some clues for preparing for the exam. Like there are several types of long-term memories and short-term memories that you can refer later. Okay, so questions can be asked from these areas. Then another memory what I have given in the option was the sensory memory. So sensory memory is the perception of sight, hearing, smell, taste and touch information that is entering through the sensory corticals of the brain and relaying through the thalamus. Okay, so it lasts only milliseconds and is mostly outside the conscious awareness. Okay, so that is very milliseconds only this memory will be lasting, and it is mostly outside the conscious awareness. That is the sensory memory, that is through the sense organs. Okay, then comes the losing memory, that is the amnesia. So amnesia is a general term that describes the memory loss, and the loss can be temporary or permanent, but amnesia usually refers to the temporary variant. Okay, so regarding amnesia, if I talk, it will take a long time. So amnesia, regarding amnesia also you can refer later. Okay, so we are getting some information regarding amnesia, short-term memory, long-term memory and sensory memory loss. Okay, so sensory memory. So that's all regarding that question. Now I think we can move on to the 11th question in our series. So the question is, Coombs test is also known as dash. Coombs test is also known as dash. So the options are option number A, anti-globulin test, Option number B, anti-albumin test. Option number C, compatibility test. And option number D, cross-matching test. So slightly confusing but very important. Coombs test is otherwise known as, the answer is option number A, that is anti-globulin test. Anti-globulin. So anti-globulin testing, also known as the Coombs test, it is an immunology laboratory procedure which is used to detect the presence of antibodies against the circulating red blood cells in the body, which then induce hemolysis. Okay, so Coombs test, you know that in the antenatal period need to be confirmed whether Coombs test is positive or not, so to prevent the further complications during the pregnancy and even after the birth of the baby. So this test is otherwise known as the anti-globulin testing. Okay, and some more information regarding this test. So the direct Coombs test detects the antibodies that are stuck to the surface of the red blood cells. So since these antibodies sometimes destroy the red blood cells, a person can be anemic, and this test can help clarify the condition. Okay, so the indirect Coombs test antibodies that are floating freely in the blood. So this is the different. Direct Coombs test means that will be detected, these antibodies will be stuck over the surface of the red blood cells, but with the indirect Coombs test, these antibodies, these are floating freely in the blood. So these antibodies could act against the certain red blood cells, and the test can be done to diagnose certain reactions to a blood transfusion. Okay, so the indirect Coombs test, it can give an information to the interactions to a blood transfusion also. Okay, so don't be confused. Okay, so Coombs test, I think you got an information. Now you will be seeing the 12th question in the screen. So the question is, early onset VAP or the VAP, ventilator associated pneumonia, occurs within how many hours after endotracheal intubation? So the question is regarding the early onset VAP. Okay, so the options for you are option number A, 72 hours, option number B, 48 hours, option number C, 60 hours, and option number D, 68 hours. So when you can expect early onset VAP, ventilator associated pneumonia? So the answer for this question is option number B, that is 48 hours. Okay, so ventilator associated pneumonia is defined by the infection of the pulmonary parenchyma in patients exposed to invasive mechanical ventilation for at least 48 hours, and it is a part of ICU acquired pneumonia. Okay, for at least 48 hours. So this is very important in ventilator, early onset ventilator associated pneumonia. So early onset VAP occurs within 48 hours, and late onset VAP means that is beyond 48 hours of endotracheal intubation. Okay, so early onset 48 hours, late onset beyond 48 hours. Okay, so I think that is clear for you. So we can move on to the next question, that is the 13th question. So the question is, minimum requirement of persons to perform log roll technique is. So the question is regarding the log roll technique, and you know in what conditions we have to use this technique. So if you want to use this technique, how many members? Minimum requirement is how many persons? So that is a question for you, and the options are option number A, 2 persons, option number B, 3 persons, option number C, 4 persons, and option number D, 5 persons. So how many persons required to perform log roll technique? Minimum. So what is the answer? So the answer for this question is option number B, that is 3 persons. Okay, so we know that the purpose of log rolling is to maintain alignment of the spine while turning and moving the patient who has had spinal injury or suspected or documented spinal injury. So that is, this is the condition, this is the indication for this log rolling. So we know that for this technique there should be used if you have to turn a casualty with a spinal injury, and ideally you need 5 helpers, but the move can be done with 3 members also. So the minimum requirement is 3, and usually you need 5 members, but if we three members are present, this log rolling technique can be done without causing any harm to the patient. Okay, so that's all regarding the log rolling technique. And now we will be moving on to the second last question, which is a picture based question, and your task is to identify the picture what I have shown in the screen. So this is the picture that you have to identify. So what is this? So the options for you are option number A, HME filter, option number B, catheter mount, option number C, water trap, option number D, swivel adapter. So what is this? So one clue is like all these things, all the options are related to the ventilator circuits. So this is a ventilator circuit, and so what is this? So this is a water trap. Okay, so we will have an explanation regarding the water trap. So this is a picture of the water trap, and this is a water trap which is attached to the ventilator circuit. So the water trap is used to collect the condensation in the circuit to prevent it from damaging the ventilator or going back into the patient. Okay, so to prevent that under gravity, okay, so the water will be collected in this instrument, in this area, that is which is known as the water trap, which is attached to the both limbs of the ventilator circuit, that both in the expiratory and the inspiratory limbs of ventilator circuits, and you can see here it is attached in this. Okay, so this is the water trap. So the other options also we will see. What is an HME filter? So HME filter, this is the picture of the HME filter. So HME stands for the heat and moisture exchange. Filters are intended to conserve a portion of the patient's exhaled heat and moisture and condition inspired gas by warming and humidifying it. Okay, so humidifying and warming, that is the main function of these HME filters. Okay, so these are also attached to the ventilator circuits in the inspiratory limb of the ventilator circuit, or okay, inspiratory limbs. Okay, so next is the catheter mount. So we can see a catheter mount with the swivel adapter here. So this is the catheter mount, and the tip you can see, this is the swivel adapter. So you can see the swivel adapter here. So the catheter mounts with the swivel connectors are used to attach the endotracheal tube to the ventilator circuit. Okay, and it will dampen the jerks and drags and increasing the patient's comfort. Okay, so this is what is known as the catheter mount. Okay, so don't be confused between catheter mount and the tip. You can see the swivel adapter, and HME filter already I have explained, and the water trap in the circuit also I have explained. Okay, so I think that was very useful for you. Now I think we can move on to the last question in the series, the very last question in the series. So the question is, T lymphocytes mature in dash. So we have B lymphocytes, T lymphocytes, which are produced in the bone marrow. So where T lymphocytes are getting matured? So that is a question for you, and the options are option number A, spleen, option number B, pituitary, option number C, adrenal, and option number D, thymus. So where T lymphocytes are getting matured? So the answer is option number D, that is thymus. T lymphocytes are getting matured in the thymus, not in the bone marrow. Okay, so we know that the precursors of T cells migrate from the bone marrow and mature in the thymus. Okay, but the B lymphocytes mature in the bone marrow. Okay, so that's all regarding the final question in the series. So with that, we are coming to the end of this session. So I think the 15 questions what we have explained or what we have discussed today will help you to prepare better for your upcoming examination. So thank you for watching the video till the end, and once again I request everyone who are watching this video to share about this platform to your nursing friends and prepare very well for the upcoming AIIMS NORCET and other nursing officer examinations. So once again, thank you for watching the video. So see you soon with the next series in the AIIMS NORCET. So till that time, signing off.